Welcome to Dean's Chat, everyone, where we talk about all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and also the host of the show. As promised, we like to bring voices and leaders in our great profession to this podcast. And today, we're going to bring future leaders in podiatric medicine. Our guests today are three third-year students at the Arizona College of Podiatric Medicine. They're just finishing up their third year, and they just started to experience clerkship rotations. So I wanted to welcome Andrew Flaherty, Jacob Riddle, and Scott Davis to Dean's Chat.
Thank you.
Thank you. Glad to be here.
It's great to have you. First thing I want to do is send out a thank you to your preceptors for letting you out of rotations this afternoon. It's the middle of the week, and I really do appreciate your ability to be here, and I thank them. First thing I'd like to do is touch base, get to know you each a little bit for the audience. Tell us a little bit about where you went to undergrad, how you discovered podiatric medicine, and perhaps why you decided to come to the Arizona College of Podiatric Medicine. Scott, let's start with you.
Okay. So I'm originally from Wyoming, but I did my undergrad in BYU, Hawaii. Followed a friend out there who was on the golf team and decided to experience Hawaii for 3 years. When I was there, I was on an internship shadowing orthopedic surgeons back in Utah at Tosh, the orthopedic specialty hospital. And I followed a foot and ankle doc for about 2 weeks. And from there, I found out about podiatry via a friend of the orthopedic surgeon and shadowed them. And that's how I kind of went into podiatry. Kind of convinced me it was a little bit easier, and if I liked surgery, I had a better chance. And so I kind of just went podiatry that way and shadowed, saw they could do everything an orthopedic foot and ankle doc could do, plus more. And so that kind of intrigued me. And then went on to do interviews at schools, and I chose AZCPM because I felt like it gave me the best opportunity to prepare for boards with the high pass rates, as well as the high residency placement. And then on top of it, I just felt like the atmosphere with the students and it being a small class was the best thing for me to form bonds with classmates and as well as faculty.
So you hadn't even been exposed to podiatric medicine until you were doing those rotations?
No, I wasn't. I was actually prepared to go MDDO to try and go ortho that way until I had met an ortho doc who had a podiatry friend. I hadn't even heard of podiatry.
So when you shadowed him, what was the first thing you saw?
It was actually a diabetic ulcer, and it was a pretty gnarly one to start the first day.
Welcome to podiatric medicine.
Yeah.
Oh, very good. Andrew, same thing. Where'd you go to undergrad, and how were you introduced to podiatric medicine, and why'd you choose the Arizona College?
All right. My name is Andrew Flaherty. I went to Austin Peay State University. It's in Clarksville, Tennessee. And I played 4 years of college baseball there. And while I was there, some of my teammates experienced, ankle, foot injuries, and they would go to team doc, and a couple were referred out to podiatrist. And I didn't know much about the profession and sat down with my college advisor and really just researched it online and found out, the ins and outs, and I liked everything. So went on to shadow doctors in town and really just fell in love with even clinic based. All the patients seemed to leave pretty happy when they came in, which was a good thing. And then surgery wise, I got to see 4 or 5 surgeries in my first month of shadowing that were just really interesting. And that was my first kind of experience in the OR. And, I really just fell in love with it and started doing immersion programs around. So I did a couple different ones at different podiatry colleges and did Midwestern one too. So that kind of gave me an insight on it and really solidified that I wanted to do it. So right after those, I took the MCAT, got a score I needed, applied to Midwestern, interviewed here first interview, and got accepted. And, the things I liked about it was, college baseball team is about 35 people, Midwestern around the 35-40 margin. I just felt like it was a good size, and I knew that, and I was comfortable with that many people, being close with them for so long. Other than that, obviously the academic side stands out here. Board pass rates in the past were great. And then some of the upperclassmen I met on those immersion programs at Midwestern really, changed the game for me. Kayla Weber being one of those. We still keep in pretty close contact every now and again. So
Kayla's down in Florida in her first year of residency. Right?
Yes, she is.
I have a question for you about your college advisor. Did your college advisor direct you towards podiatric medicine, or did you enlighten your college advisor?
It was kind of, we've heard the term, and we were sitting in his office. Ryan Combs, if you're listening to this, we were sitting in his office and we were Googling, career fields to go into. If you have a bio major, chem minor. And we made a whole long list, and, we kind of picked out ones that we have known of and then researched those. And we were kind of learning about podiatry at the same time. And, everything we were finding, we even watched YouTube videos in his office during lunch break, just, the ins and outs of podiatry, and really just fell in love with it. Yeah.
Well, that's fantastic. We'll talk more about college advisors and recruitment for the profession a little bit later in the show. How's that sound? Jacob, your background, how you found out about podiatric medicine, and how you ended up at the Arizona College.
Yeah, so my name's Jacob Riddle, and I'm also a third year at AZCPM. I'm an Arizona native, so I was born and raised in Arizona. I went to my undergrad at ASU, go Devils. And while I was at ASU, I was actually working part-time as a scribe for one of the big ortho groups out here, Ortho Arizona. And I was working with a lot of like hip and knee guys, but particularly I really liked working with the hand surgeons. And at my time there, I realized that hand surgery really interested me, orthopedics in general. And that was kind of a route I was wanting to pursue. But then I ended up getting married, and my wife's husband, he was actually a podiatrist working in Kansas. And I just expressed to him that I was interested in orthopedics, I was interested in hand surgery, and he got excited and said that I should probably go shadow him. And at that point, I never even really knew what podiatry was. I didn't know that it was its own field of medicine. So it was all new to me. So I made the trek out to Kansas, shadowed him, and I realized that the foot clinic was very similar to the hand clinic. The hand and the feet are very similar, but there's a lot more pathologies that can happen in the feet. Obviously, we're walking on them, they're weight bearing. And there's also a lot of other aspects to podiatry as well, like you got the wound care, you got the nail care, and it still had that surgical aspect that I was looking for as well. So I just saw a lot more variety in the profession, and that really interested me too. So I started exploring it more, and I realized that it was kind of like the hidden gem of the medical field. I realized it was more streamlined. It was still medicine. So we got all the same education that the medical students got. But at the same time, we got that extra education that kind of springboarded our profession. Whereas with the MDs and DOs, you don't really know what you're going to be until the end of your 4 years. And at that point, it's kind of like a lottery system. You have no idea what you're going to end up doing. So I kind of like the idea of going through my 4 years of school and knowing exactly what I'd be doing at the end of it, and then being an expert in that field before I even graduate. So,
I think that's a common theme, having the end game in mind, right? Mm-hmm. When you come into the college or the profession. So that's great. When you did your shadowing, was it a private practice or was it a hospital-based clinic?
So I shadowed a private practice here in Arizona. But when I shadowed my wife's uncle, he actually had a pretty sweet setup in Kansas. He was in the hospital, but he had his own clinic there as well. So he was like the only podiatrist within like hundreds of miles. And so he got a lot of different demographics of patients and stuff like that. So it was interesting to see him in the hospital setting as well.
I think it's interesting how the shadowing experience really impacts a student who's considering podiatric medicine. It seems to be the common theme.
Definitely. After just talking with him and then seeing his day-to-day schedule and what it was like in his clinic, that pretty much sold me on it. So,
well, very good. So let's do a little history here and go back a few years and talk about when you first came to Arizona, and we had an orientation week. And then all of a sudden you wake up one day and you're in court class, right? It's biomechanics and anatomy and pod med that first quarter. Let's talk about those first couple of years, knowing full well that boards was waiting for you at the end of 2 years. And tell us about the basic sciences experience. And then what I wanted to specifically get into is talk about the lower extremity anatomy course. Andrew, your thoughts on the basic science years?
So for basic science, I really think one of the best parts about Midwestern is being integrated with those DOs, because my majority of my study time was in a study group with DOs. So it'd be me and another person from class. And then we were with 4 or 5 DO students, and we study in the cafeteria, write everything down, and really having, 2 different, career fields, if you want, going at the same subjects together. You have their input, you have your input. I thought it was a really good group to, help you score very well in those classes. So
I think it's interesting that all of our students are mixed in with the DO students. So you've got a basic science group of about 290 students, and the professors don't even know if you're podiatry or DO.
Right.
A lot of the students don't even know either. And a lot of the students don't even know what podiatry is until we educated them on it. So,
right. I think it's interesting because I will get calls from the basic science faculty and they'll say, oh my gosh, one of your students is number one in the class. And so I'm always proud of how you all deliver in the basic sciences when you're competing with the DO students. Well done. Your experience.
So my experience was probably about the same as Andrew. I guess it was probably a little more intimidating since I had taken basically like 2 years off, coming from undergrad and worked construction. So I hadn't seen the inside of a classroom or textbook in 2 years. But it was great to, actually, find some friends and make the connections and study together. I felt like that was like the biggest advantage, was having like a close friend to navigate through the basic sciences, but definitely getting the amount of education you get here with the in-depth of the basic sciences, I felt was like a lot better than I could have gotten at any of the other schools, just because we are integrated with the DOs. And I felt like it basically set the bar for how much needed to study, how much knowledge you needed to go into the medical field to not only be a podiatrist, but to be like a physician of any form, to know if any form of issues arise, that you're not just limited to, oh, I only know foot and ankle, but you can like help with any form of issues. And I felt like that was like the advantage of the basic sciences here, because they go so much in depth, because it's not just podiatry, but it is for DO students as well.
Well said. Well said. Jacob.
my experience was probably similar to theirs. I really appreciated the first 2 years of our education because I did feel like we were getting the holistic entire education, the medical education that any other DO or MD would get. It felt very complete. It didn't feel like I was missing anything at all. Sometimes it felt overwhelming just because I was like, wow, I'm never going to be a heart surgeon, so why do I need to go this in depth? But I mean, we did everything that the DOs did. So I was really pleased with that. It made me feel like I was going to actually be a real doctor and a physician, which we are. So I felt very prepared for my board exams at the end of my 2 years, just because of the medical education that we did get. And just after talking to some other students from some of the other podiatry schools as well, I'm very involved in APMSA. So I get the luxury of talking to those other students. And I've just realized that our education here is very heavy in the medicine and general sciences. So that's something I'm really glad that we got here at AZCPM. So
very good. So we'll have the class of 2027 coming in August. And my experience over the years is students have a lot of free-floating anxiety because they've done well in undergrad, but they're not really sure how they're going to handle the volume of material in a quarterly basis for 9 weeks. How did your study habits evolve to the point where you got to the point where you were confident that you'd do well in the classes? And did they evolve? Did you come in and have what it takes from the beginning? Scott.
So since I hadn't been in class for 2 years, I really hit it hard. I spent the entire first week studying from sunrise to about 11 o'clock at night, just because I had the feeling I was I can't fail. I can't, take 2 years off, come in and then just wash out right away. So I spent a lot of time, and I felt like my grades reflected it after the first quarter, and I felt like I evolved as time went on. It definitely was a little harder since it was during COVID, so we weren't really on campus much. And so I would call and talk to different classmates over the phone or through Teams. But I definitely realized my studying habits evolved over time. I became more efficient as the quarters went on, and kind of felt like I was able to understand the material better, and also realized how professors would teach. So you pick up on what they're emphasizing, on what they really want you to know, the main key points, rather than just kind of trying to memorize everything that they have. So I feel like that was probably the biggest thing is it is possible even if you take a long time off. You just have to put the time in the beginning and then adjust from there.
And be disciplined. Yeah. Jacob, what were your study strategies and how'd they evolve?
So I came in straight from my undergrad. I didn't have the 2 years off like Scott got. And I noticed real fast that my study habits from my undergrad had to change significantly to study for podiatry. particularly, I remember my undergrad just being really easy. I remember like I could study for the exam the night before and get straight A's, get like ace all the exams. And I realized real fast I couldn't do that in medical school. So I had to give it my full time. Essentially, I'd have to study 8 to 10 hours a day and just grind, study a lot of notes. Group study helped a lot too. I noticed that a lot of people study differently than I did. So I kind of analyzed how they were studying and adapted my strategies. So a lot of it came down to, like Scott said, finding out how the teachers, different professors teach, what they expect, analyze the key topics, and then, just grinding, essentially. It took a lot of perseverance. So,
well said. Andrew, your experience.
Yeah, it was definitely another level than undergrad. Obviously, you guys tell us that and to prepare for that, but there's just no way of knowing until you get here. And I feel like the biggest thing for me was just trying different strategies, and that kept going all through first year. I really didn't fine tune it until into second year. It's just trying, different flashcards or different study groups or this or that. And then on top of that, just the resources that we have at Midwestern with the faculty, you can send them a personal email to their Outlook and they'll respond in a couple hours and have you into their office reviewing practice questions 2 days before an exam. They're really great about that. And then also on top of that, we have the big and little SIB pairings here. And my big Ashley, she helped me so much with, study suggestions or strategies, all of that stuff. And it's really just the resources really helped me get to that level.
So if you were each of you to give one piece of advice to incoming students, what would it be, Andrew?
Mine would, don't be scared to try different study tactics. Even if you're scoring, a little lower than you think that you want to be, try something new out. Don't sell out completely and mess something up, but, add different little things in there. And then I would just talk to the class right above you. There's no better person to guide you through the process as someone that just went through it. Me and Scott and Jacob were kind of getting out of the game now. Classes have changed, professors have changed. You really just have to rely on that class as adjacent to you as possible.
Scott, what would be your nugget of advice?
I would say dedication, just like time, putting in the time, the hours. I mean, a lot of people come in hoping they're going to get, that podiatry, 8 to 5, have a great work-life balance. It's not that. I mean, you gotta earn that. So start off putting in the time, the hours, 8, 10 hour, 12 hour long days. Make sure you get your foundation. And I'd throw in, since you're in person now, find at least a couple study partners. Makes it a lot easier to understand things. If you can teach it to one person, then you know it. So I'd say time and then study partners.
There seems to be no substitute for time and effort or grinding, as you would say, Jacob. What would be your one nugget?
Yeah, adding to that, I mean, I remember studying nights, weekends, holidays, you name it. I pulled so many all-nighters just trying to make sure I knew everything before the exam the next morning. But if I could give one piece of advice, it'd probably be kind of what Andrew said. Definitely link up with some of the higher classmen, people who have already gone through the class. They've figured out how to study. They know the good tips to give you, the good resources that help them. So that was valuable information to get from the upper class for sure.
What was your hardest class the first 2 years? Scott?
I'd say the hardest class for me was probably physiology, just because even from undergrad, I just never truly loved physiology. For some reason, it just didn't click with me. So that was the class I had to spend the most time with. But I felt like all of them were pretty tough, but physiology was just a different beast for me.
Very good. Jacob?
Probably anatomy and physiology for the first year. The second year, I would say probably pharmacology was definitely a beast for me. So, yeah.
Very good. Andrew?
Mine would be neuroanatomy, winter quarter, that final. I know classes have changed up, how many blocks are in each exam now. But when we took it, what was it? 80 questions, somewhere around there.
Yeah.
It was quite the exam, and then second year, it'd be the final for pharm, but it was great board prep looking back on it, studying for a cumulative exam that's over 8 other exams, everything pharm based. It was really nice to help for boards, but terrible at the time.
Well, we always talk about the 3 Ps: pharm, path, and physio as being super challenging for all the students at all the colleges. And there are years where we have 100% pass rate at all three of those. So I always tell students, the best predictor for passing boards is just getting through the curriculum. And I think that there's a lot of truth to that. Can we spend a couple minutes talking about anatomy? I think you take your first anatomy course the first year in conjunction with the DOs. And then we have at the beginning of the summer of your second year, we have our lower extremity dissection lab. And I've always said that anatomy is so important because both biomechanics and surgery is really just applied anatomy in many ways. Can you comment on our lower extremity anatomy dissection lab? Because we are routinely 10 to 15 percentage points higher than the national average. Jacob?
Yeah, so I really appreciate it. So we have summer classes here at AZCPM. So we kind of follow the same schedule as the DOs throughout all the normal quarters. But during the summer, they usually have that off. And then we go into depth with our podiatry specific classes. So the first summer, we had our lower extremity anatomy course. And that was pretty much very deep, extensive dissection labs and just anatomy classwork as well. But in the dissection labs, I remember that we went very in depth to the physiology and the anatomy of the different structures, the different tendons, the different musculature, the different levels of muscles in the foot, which is just education that we didn't really get in our anatomy class with the DOs. So we definitely went further in depth, and it made me feel like we were actually specializing in podiatry and the foot and ankle, which is different than what other medical professions get. So,
Scott?
Yeah, I really enjoyed lower extremity anatomy. I don't know if it might have changed, but we usually start with like the didactics first, and you go through all the didactics, make sure you know in and out, have exams on that. And then really the second half of lower extremity anatomy, you're in the lab, the anatomy lab, 4 days a week from like 8 a.m. to noon. And it's just you and one other person per leg. And essentially you're just from like upper thigh all the way down, and you two are the only two people touching that leg. You're the only ones dissecting it, identifying everything. So if you mess up, it's on YouTube, but it's a great opportunity to really see everything from every layer. And it was great to walk around and see everybody else's legs, because I mean, everybody's leg was different, how much fat's on there, how little of fat, the different variations between tendons and nerves, where they come in and out. Just you got to see everything. And so I felt like it was very hands-on, and it was great for us to be able to experience, how to use the scalpel, how to use the dissection scissors, which are probably the most important thing over the scalpel, because then you're able to preserve everything. And so I felt like us getting, 4 hours for 4 days a week for about like 5 weeks was great prep for us going into clerkships.
Well said. Well said. Andrew?
I think Scott hit that perfect. It really was when you started fine-tuning your hand skills. I know for us, our dissection lab for general anatomy was a little bit limited. Most everything was pre-dissected just because of COVID. You didn't want to have everybody in the same lab at the same time. So they would pre-dissect, and you just go in and kind of have a shortened time just during COVID there. So it was our first time to really be hands-on and learn how to work. And with other classmates in the same room, it made you want to make it look good, because you all walked around and looked at each other's legs. And it was, a little competitive, but it definitely lets you know that, hey, I don't want to just be hacking at it, because someone's going to come along and, make sure you're doing all right. And then the didactic portion, I thought it was a really good prep for, even boards for the next year. I used all of my same lectures, all of my same highlights, notes, and everything for boards, which was a year after that.
But I'll add the thing that Andrew was saying, you want to make it look good, is because at the end, you use everybody's legs for your exam to identify key pieces. So they'll give you a list of, these are what you want to identify, pin them, and you're using somebody else's leg. So you're not only are you trying to make your leg look good for you and know the stuff, but it's also beneficial for your classmates, because they're coming in and they're seeing your leg maybe for the first time and have to identify things. So hopefully you didn't cut something out you weren't supposed to.
Very good. Yeah. And that's important. I mean, you're doing it for not just yourself, but others. So as you were approaching boards part one, What kind of study strategies did you take? Did you get enough time? Did you get enough time off? I mean, as a class, you did phenomenally well on boards. We're top of the country. So what was your strategy going into studying for boards that resulted in passing? Andrew?
So I kind of used studying for spring quarterfinals as my gateway into studying for boards. So we had farm and path right there. So it kind of knocked 2 subjects out just by, doing well in those finals, where you didn't really have to hit it that heavy going into boards. You felt prepared for that. And then I really just relied on board vitals for general anatomy or general medicine. And I went through that once. I did practice questions online with what is Board Vitals Practice Questions First Aid book, and then Sketchy for the rest. And then I would use the lower extremity PowerPoints from the previous year. I felt like that prepared me very well. I definitely felt good.
Very good. Jacob?
So the best tip I got from an upperclassman would be using the USMLE Step 1 First Aid study book. I read that thing front to back, and I can confidently say that if it wasn't for that book, I probably wouldn't have done as well as I did on boards. It just covers all the high yield material that you'll need for board exams part 1. I used that, and I supplemented it with some YouTube videos that were really good. Also, Sketchy was an amazing resource for me, especially with micro and farm. Luckily, our classes actually prepared us very well for boards. We had a very cumulative final for pharmacology at the end, which kind of helped me feel a lot more comfortable with that. So I didn't have to spend a lot of time studying on it during the summer. But yeah, I would say USMLE First Aid was the best resource I used.
Those YouTube videos, physiology for students, all muscle contractions, heart contractions, all of that. It was a great resource.
That and Dirty Medicine for the biochemistry portion of it, that helped me a ton. He just listed out, this is high yield, this is high yield. Don't worry about this, don't worry about this. So I really appreciated that.
Scott?
So I did kind of like a combo of both of them. I did Sketchy for like micro and some farm. I used the USMLE book to look up different things, study some of their high yield topics that I knew would overlap into our boards. I used old slides. I did board vitals a couple of times. And then I also, the drive that the students get, have some other schools PowerPoints that had been passed on with permission. And so I used a couple of those. But I did a lot of practice questions. There was like the NBCPM practice questions, like the company that puts on the boards. They had old exams, and I did, I think, probably like 8 or 9 of those in preparation. And then I did the ones that they put out specifically for the year. And I felt like those were probably like the biggest advantage was to, actually see questions you're going to see and then just kind of get repetition with those. But I felt like classes had prepared us well for the questions because they were shorter, more direct, rather than our classes had big paragraphs. You have to dissect the information. These were more of just like pinpoint, you know it or you don't. And I felt like our classes had prepared us for that.
Excellent. So what was it like when you found out you passed board part 1?
Well, I went and played golf at TPC Champions course right afterwards. So it was a good day.
Very good.
I actually joined Andrew. It was a great day because it was my 5-year anniversary. So I was hoping I would pass. So it would be an extra good day, anniversary and boards pass.
It was the biggest weight lifted off my shoulders. I just felt so relieved knowing that I would go on to my next 2 years of medical school. So that felt really good. Me and my wife went out to a really expensive dinner at Arrowhead Grill and just blew money on some good food. So it was fun.
That's fantastic. Well, really, it's the first big hurdle in becoming a podiatric physician. So that's exciting times. So the excitement doesn't last that long, though, because you jump from one fire to the next and you finished up the podiatric curriculum. Let's talk about that for a couple of minutes. Let's talk about biomechanics. How was biomechanics? And I ask because when we get our board scores back, we're 20 points higher than the national average. So, biomechanics, orthopedics, pediatric orthopedics. How did that play out for you in studying, and have you seen it in rotations?
Biomechanics was a beast at first, just to kind of wrap your head around like the 3D like angles and how all the different parts of the foot work together in different like phases of gait and all that. So it's kind of it's a lot at first, and it was hard to really conceptualize everything at once. But I think we had like 3 different classes of biomechanics and pathomechanics and how the biomechanics are important during surgery and all that. So we really hit it hard. We have some really good professors here at AZCPM that are experts in biomechanics. So I think that after all the classes that we had, it just prepared us very well for it. So
I would say the same thing. Biomechanics was definitely, something you went in the first day of class and it seemed like a foreign language to you for a little bit. And then you kind of got the ball rolling, and Dr. Toms did a great job. If you, didn't understand some concepts, just go into our office and talk through it all. And, once you talk it out to either a professor or a classmate, it really, starts to make sense. You use the foot model that we all get, kind of see how the foot compensates for this, that, how it's positioned, all that. It kind of comes into one big piece in the end.
It takes a while for it to all come together, though.
It does.
Scott, what was your experience?
I would say probably about the same as like Andrew's. Walk in, and it's like a foreign language. But over the course of the 3 different quarters that you have it, just slowly incorporating the piece by piece to realize that everything you learned at the very beginning is now being applied, and you can kind of understand how the foot functions. And then by our last one, we were starting to do orthotics right before we were supposed to go on third-year rotations. It kind of made sense of like, oh, the person has this type of gait, their foot, everts, inverts, does all this stuff. It's like, what type of orthotic you can give? And you're able to kind of put all the pieces together to, accommodate their foot and make it so it's more functional and works best for them.
You just reminded me, your class really was hit by COVID hard when it came to labs.
Yeah.
If I remember correctly, we had to just delay by 1 month you going out on rotation, and we just packed that month with labs that you didn't get prior. So let's start talking about third-year rotations. What rotations did you do? Feel free to give some third-year preceptor shout-outs to people you enjoyed being with and that prepared you for externships. We'll talk about externships in a minute. Scott, you want to start?
Yeah, I can start. So I first went to University of Arizona, went down there and was with them, the salsa clinic. I felt like it was great. Saw a lot of diabetic wounds, got into do surgery, was with Dr. Patel, who's a Midwestern alum. And it was great to learn from him and see, because he knows basically every professor and saw the curriculum, went through it and kind of applied it. So that was great with him. And then I came back, went with Dr. Corley, also another alum, great. Got to do a lot of hands-on with him, especially, first time in surgery, doing hands-on. And then jumped with Dr. Case, another alum. Dr. Case, phenomenal, great hands, some of the best I've seen in the OR, and very knowledgeable. And then I actually got the chance to go to the Phoenix VA. Great rotation, especially since it's student basically run, their clinic. Didn't spend a whole lot of time in the OR there just because of the amount of students there, but got clinic every day, and you're basically your own person. You're the resident essentially, getting to do everything. So I felt like that was great. And then finished off with the Midwestern clinic, and I felt like that was the great last place for me before I headed off to my first clerkship.
So did you feel prepared for clerkships then?
Yeah, I did. I felt like my first clerkship in East Orlando went great, and I felt like I had seen a lot and been asked a lot of questions to help prepare me for that first rotation.
I know when I talked to Dr. Case, he said his sole goal in having third-year students is to prepare them for clerkships. So I'm glad you had time to spend with him. Jacob, what's your experience been?
I really enjoyed my third-year rotation. So my first one was at a private practice with Dr. Brower, Dr. Fitzer down in Avondale. They were phenomenal. Dr. Fitzer was really heavy in clinic. She didn't do a ton of surgery, but Brower did a lot of like rear foot stuff, which was fun. But I felt really comfortable after leaving that because I felt like I went in not really strong in my clinical skills at all. But I remember we did tons of matrixectomies, tons of castings in the clinic. So I think I did probably like 20 to 30 matrixectomies by the end of that rotation. And I just felt comfortable doing it, which prepared me for the next rotations that I did. And then I was with Dr. Lee next in Surprise, and he was phenomenal. I was not very strong in my biomechanics until I left his rotation, and he's super big on biomechanics and just the pathologies in the foot that are related to everything biomechanical. So He pimped me really hard, asked me tons of hard questions that I admittedly didn't know the answers to until I left, which is what third year rotations is all about. You kind of have to go in knowing that you don't know a lot of things and just be open-minded to the different ways that different doctors do things. But Dr. Lee was definitely, he prepared me very well for biomechanics. Then after that, I went down to Salsa, also down in Tucson, and I saw tons of really awesome wounds there. I worked with some really great doctors. And then I had an endocrinology rotation for my medicine rotation. And I just learned a ton about diabetes, about thyroid, adrenal, all that stuff. So I felt like I could actually apply the medicine knowledge that I gained at AZCPM and just see what it's like in a normal endocrinologist office, which was fun. And then I went to the Phoenix VA, and that was a ton of fun because there they actually give all the students a ton of autonomy, and you're actually running like your own little room in your own clinic. And that felt really cool, just being able to see patients from start to finish and work them up and get a lot of experience and practice with that. They trusted us with the scalpels and all the instruments. So we're actually like doing little in-office procedures on the patients. And I got very comfortable doing those also. And then after that, I went out on clerkships and I felt really good being there for my first one.
Very good. Dr. David Lee and I were classmates.
Oh, very cool.
Yep, we went to California College of Podiatric Medicine, studied medicine together, and it doesn't surprise me that he knows his biomechanics.
He knows his stuff for sure.
Absolutely.
He'll make sure that you know it too.
That's good. That's why we have him.
Yeah.
Andrew.
All right. My rotation started off with Dr. Case, and he really just built the foundation of, how to hold yourself during your rotation. It was a very professional clinic. It was great. You learned some just kind of clinic basis, and then he was going through the process of, practice management and kind of ran me through some of that. And then on top of that, he did a lot of elective surgeries while I was there, and it just built the foundation of hand skills too, seeing him work and then understanding where I need to be and where I don't need to be, what's next, what's needed after that. So that was just, a great start to rotations. And then after that, I went to Dr. Rand and Dr. Zafar there at John C. Lincoln here, and they did 2 half days a week at a wound care center. So, early on, just seeing wounds, that was such great experience, debriding, understanding what you need to put on the wound, the wound environment, some total contact casts, all that good stuff. So that was a great rotation, got to see a lot. And then they also took call. So saw my first calc fractures, talar neck fractures, stuff like that. So it's just kind of a great, adjunct to what Dr. K has just taught. And then after that, I went to Dr. Aaron Martin in Scottsdale, and it was a shortened rotation just because it was about to be Christmas break. But just learned a lot about, how to hold yourself in clinic and how clinics run, different things of when you're getting out of residency, what you should look for in the next clinic you're going to work at. After that, I went to Dr. Pinedo, and once again, he was in the transition of moving clinics. He came from Texas at Hunt Regional there. He was attending there, and he really helped explain, what to expect when I come out of residency, and then what to, expect while in residency, since he had residence so recently. And then I went to do my family medicine rotation across the street of Midwestern campus. And then I went out to East Orlando, same month as Scott, got to be roommates there. And then now I'm working at Midwestern Clinic with Dr. Kowalski and Curtis.
So you were both at East Orlando together.
We were.
Dr. Shane, Dr. Reeves. What was it like doing your first clerkship in Florida at a very renowned program? When we've had students from Arizona go there and be their residents. Currently, Jacob Ivy's there.
Yeah. Mm-hmm. So it was great. I know for me, I really wanted to experience a month there, and I put it as early as I could to kind of solidify that. And, you're not going to know everything early on, which, you hate to not know all PIM questions, but it was great to get the ball rolling. The list of topics we talked about while I was there, it's pages and pages long. And then while we're there, the didactics we had, AO principles. And then we even had a research talk one day. It was just a great, start, and really sparked your interest of, I think we saw 70 or 80 cases while we were there. It was, since there's only 2 students there, normally they take 4, it was 2 weeks of call each. Lots of cases. It was very busy, but it was awesome.
Scott, you concur?
Oh yeah, I concur. It was definitely a great place to rotate. I went there sheerly because I thought I just wanted to get, a great, first rotation, but I actually, fell in love with the program. The best thing I felt was that they do like minimal clinic, and they just, 3 years of surgical residency. So they're really taking that to the max of you're seeing the OR every day, basically, except for a half day a week. And they're starting you off small. You're with Dr. Smith, who's transitioned now to like diabetic limb salvage. And then you slowly work your way up to do the elective cases, and then you get the big trauma cases. But I thought like the progression of seeing like the first year's hands to the third year's hands was just phenomenal. And like seeing the third years go in and do, a case from start to finish without any issues, have ideas, be able to change on the fly was just amazing. And like Andrew, a lot of questions you don't know because you can't know those until you're in that surgery. And I mean, if you haven't seen that surgery before, you definitely, everything you read isn't going to tell you all the ins and outs and the secrets behind, what makes you a good surgeon. And I felt like that was very beneficial to see.
It sounds like a fantastic springboard into the fourth year.
Yeah. And we say minimal clinic, but Dr. Shane was seeing quite a number of patients per day. Even if we were there for a half day, we were seeing 20, 30, 40 patients.
Yeah.
It was definitely busy, but to build on East, it definitely taught us how to prepare for cases the night before. It's definitely a stepping stone, and teaches us how to get better.
Jacob, where did you do your first clerkship?
So my first clerkship was at Denver Health in Colorado, and that was actually a pretty phenomenal program. We split up our time with the VA there and Denver Health, the hospital right in downtown Denver. It was a really good experience. We saw a bunch of stuff that I wouldn't have seen here in Arizona. They got like lots of frostbite cases. I know there was a lot of trauma there too, like gunshot wounds and ankle fractures. And they were very busy in the OR too. I remember some days we did like 8 to 9 cases in a day. So it felt really busy. And the biggest thing that impressed me about that program was I saw that a lot of the first and second year residents were actually already very competent with their surgical skills. To the point where a lot of the attendings trusted them enough that they wouldn't even scrub in until the residents actually asked for help. I'm not sure if I'm allowed to say that or not, but they trusted their residents, which I thought was impressive compared to some other programs I know where some of the third years are maybe less competent. I'm not sure, but I was very impressed with the third year residents and the job offers they got and the things that they were able to do in the OR. So.
A little shout out to Christine Hoffman, who's their program director.
Oh my gosh, she's awesome. She was so fun.
I remember Christine when she graduated from the Scholl College, and she came and did our residency program in Colorado. So she was a great student and a great resident, and I'm super proud of her to see her leading up the Denver Health program.
Yeah, and she loves fly fishing, so that'd be fun if I ever got that program to do some fishing with her.
And she's a heck of a rock climber too.
Oh yeah.
So Jacob, where are you heading now for the next, let's say between now and January? I imagine you've got a lot of destinations ahead of you.
Oh yeah, like 7 different states. So next month I'm in San Antonio, Texas, and then I go to New Orleans, and then I go to Indianapolis, Dr. DeHeer's program there. So I'm really excited for that one. Then I go to Iowa, Waterloo, and then I have 2 in Michigan. So that'll be fun also. And then I'm back at PSL in Colorado.
Excellent. A lot of frequent flyer miles.
We're driving the whole way, so we get to see the country.
Congratulations. That you're going to have a wonderful experience. That's fabulous.
Yep.
Scott, what are your plans for the rest of the year leading up to interviews in January?
So next month, I'm actually at Scripps Mercy. Got the connection there with Ryan Bodiger, first year resident. So I'm going there, and then I go to San Antonio as well for core. And then I'm going to Ascension Milwaukee.
Dr. Dye's program.
Yep. Got that in July. And then I go to JPS. And then I go to Evansville. A lot of Midwestern alum there.
Sure, absolutely.
And then I have Hunt Regional in Dallas. And then I go to Norton in Louisville. And then I also go to University of Louisville.
Fantastic. It's interesting because when you're picking clerkships, you're kind of thinking that everybody thinks like you do and everybody wants to go to the same programs. And then you realize that's just not true. There's so many great programs out there. And Andrew, where are you off to?
So next month I go to President St. Luke's in Denver, and then I'll do Denver Health after that in June. And then I bounce down to Hunt Regional where Joe Galvin is. And then I'll go to Vanderbilt and Central Michigan after that. And then I finish with JFK and Westside down in South Florida.
It's very ambitious also.
Yeah, I'm driving the whole way, just packed in a car and make it a road trip.
I remember when Joe Galvin was here as a student, talk about a Dallas Cowboy fan. Wow.
Yeah.
Give him my regards when you see him.
Hey, I'm a Dallas Cowboys fan too, so I can't feel too bad for him. I feel bad for myself.
No, that's great. Well, we're running almost out of time. Any last comments that you might have regarding podiatric medicine or your experiences so far? Scott.
I think, it's just getting to experience it. Like if you're a prospective student, undergrad, trying to figure out what medical field you want to go into, don't forget to look at podiatric medicine if you haven't heard of it, kind of get in and see what it's all about. Maybe it is for you. And then I think like just the best thing I've seen so far is just, the growth that you can get, from the day one of school, your knowledge that you gain through the first 2 years of didactics, and then the first year of, being local, getting your hands on feet, being able to figure out, I can actually, diagnose a patient or, at least come up with differentials, and then seeing the progress through the residents, watching residents from first to third year, their progression and how good they become. So I just, like the aspect of, you never stop learning. You're always getting more knowledge and you're getting better at your profession.
It's 7 years, and on one hand, it seems like forever. And on the other hand, it goes by the blink of an eye. Jacob, last comments from you.
Yeah, so I would say that if you're a prospective student also, and you're interested in medicine, and if you're interested in surgery, you're interested in intimate patient care, definitely give podiatry a look. Definitely go shadow a podiatrist, talk to as many podiatrists as you can, get their opinions from podiatrists themselves, not from other people who maybe don't know the profession as well as the ones that are in it and practicing currently. There's a lot of really interesting things happening in the profession right now, and it's actually really exciting to see all the advances that have been made even in the last decade or so, and to see the changes that are going to be happening within the next decade, I think is very exciting. So if you want a promising profession and you want to have a good work-life balance, then definitely consider podiatry.
Well said. Thank you. Andrew.
I think the main thing is just education of, prospective students, anyone that's pre-med, and there's a large majority that just don't know about podiatry, and I just got lucky with a Google search and word of mouth. Some people just never get that. So I think just education from, the admissions mentors and stuff like that in colleges. And the next thing is just shadowing. And I wouldn't limit yourself to shadowing just one doctor. I would highly suggest going to multiple. You never know if, maybe one doc is just having a really rough week and you go and you just don't click well. Don't write off the career just by, one bad clinic. Go and try a couple different ones, make sure you get to see surgery and make sure that interests you, because it is a large portion of, what we're doing. So,
and I think there's so many pre-med students out there. And if you don't know about podiatric medicine, I think it's incumbent on our profession to make sure the advisors are knowledgeable about the profession. And then the advisors have a go-to doctor that they can send their students to shadow at. Right. I mean, it just makes sense because shadowing is just so important. Well, I just wanted to thank all three of you for taking time out of your busy schedule to come and share your experiences at the Arizona College. I thank you for coming to Arizona. You three have really represented our school well, and I know that you will continue to do that this year. I speak for all the faculty that we're super proud of you guys, and we're looking forward to following you throughout your career. Thank you very much.
Thank you.
Thank you.
Thank you.
And thank you to all of our listeners out there. We appreciate you tuning into Dean's Chat. We'll continue to bring all things podiatric medicine to you. And hopefully in the future, we'll continue to bring more leaders in the profession. And until then, cheers. And don't forget to give us a 5-star rating. Bye-bye, guys.